I'm Dr. Richard Reindollar. I'm the chair of OBGYN, and I'm hoping that every one of you wants to go into obstetrics and gynecology. Now, I understand that what you'd really like to know is what elective should you take if you're really interested in OBGYN. And I think if you think about Dr. Sue Harper's podcast, that there really are three things you should keep in mind. First of all, there is the exploratory. Hopefully you know you want to go into OBGYN, but you may have some suspicion that there's some subspecialty that you'd really like, be it reproductive endocrinology, GYN oncology, and it would be really nice if you really took an elective and yes, you firmed that up as you moved on. No doubt the next types of electives are the trials. You go to a center, an academic medical center or a residency that you think you really want to go to, and then you go and you do a tryout. So you're doing an elective to impress them. Only do them, however, if you're going to absolutely do a bang-up job and work at 120%, so that you can come away from there having not only the best experience, but they truly want you. Otherwise, if you're not going to do the absolute best job that you possibly could, it could be a detriment to you as you're applying. I think the third thing, though, is if you're going into OBGYN, your clerkship could be all that's necessary for your training in OBGYN, because as you go into your residency, you're clearly going to get trained in that area. So what I would really advise is take a long time and think about those areas that you would like additional information that you may not have access to learning in your residency. It might be dermatology. Dermatology helps everyone in any subspecialty they go into. It could be radiology. It could be electrocardiography, learning how to read an EKG, or cardiology. Or a really good one could be emergency medicine. So I think that when you're thinking about OBGYN, you're going to probably learn in your clerkship the basis of what you need. But clearly, some of these electives could help you decide whether you like one of the subspecialties, could help you get your residency position if there's a place you really want to go, or could really help you get that information that you could use during your residency. As you're looking through all the possibilities for your electives, if you have any questions whatsoever, I hope you will absolutely consider giving us a call, myself, anyone in the department, Dr. Davis, and asking for further advice that will get you the best elective possible.